Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi taala wabarakatuh dan salam sejahtera. Yang berbahagia Datuk Dr. Haji Raizat Haji Yun, Timbalan Ketua Pengarah Kesihatan Perubatan Kementerian Kesihatan Malaysia. Yang berbahagia Datuk Dr. Nohizan Ismail, Pengarah Perkembangan Perubatan Kementerian Kesihatan Malaysia. Yang berbahagia Datin Asmahan Muhammad Ismail, Pengerusi Clinical Practice Guideline CPG Management Rheumatoid Arthritis. Yang berusaha Dr. Umar Wiswalingam, Pengerusi CPG Management of Major Depressive Disorder 2nd Edition. Yang berusaha Dr. Anita Bagawi, Pengerusi CPG Management of Breast Cancer 3rd Edition. Yang berusaha Dr. Haniza Omar, Pengerusi CPG Management of Chronic Hepatitis C in Adults. Datuk-datuk, datin-datin, tuan-tuan dan puan-puan sekalian. First and foremost, I'm delighted to be with you today on the launching of 4 clinical practice guidelines. There is Management of Major Depressive Disorder 2nd Edition, Rheumatoid Arthritis, Breast Cancer 3rd Edition, and Chronic Hepatitis in Adults. I would like to thank the organizer, in particular the Medical Development Division, Ministry of Health, for inviting me to this occasion. Ladies and gentlemen, COVID-19 is currently the health issues dominating headlines globally. Despite being a communicable disease, it has highlighted a close relationship between communicable and non-communicable diseases in terms of health outcomes. We now know that COVID-19 affects the population disproportionately. Older adults and individuals with NCDs and NCDs risk factors are at higher risk of severe COVID-19 and death. The underlying social determinants of health that includes an aging population, increasing income disparity, rapid urbanization, and globalization are strongly correlated to increasing burden of diseases in Malaysia for both communicable and non-communicable diseases. Data from the National Health and Mobility Survey in 2019 showed that prevalence of NCD risk factors continue to increase. This is of major concern to the Ministry of Health, and our action requires a more aggressive whole-of-government approach. Ladies and gentlemen, the National Health Mobility Survey 2019 also included a survey on healthcare demand. Malaysia is recognized as one of the countries with the best healthcare system in the world. Malaysia government provides highly subsidized healthcare services to all Malaysians in the public healthcare facilities. For healthcare services, National Health Mobility Survey 2019 found that the majority of the population use healthcare services in the public sector compared with the private sector. For inpatient healthcare services, 76% of the population sought treatment in the public sector, while for outpatient healthcare services, 64% are in the public sector. Regardless of the public and private healthcare sectors, it is very important for us to deliver quality care to ensure the best healthcare outcomes for our patients and maintaining their quality of life. Diseases worldwide can be broadly categorized into NCDs and communicable diseases. The NCDs, like cancer, mental disorders, and inflammatory joint diseases, are becoming more prevalent in the country. As for communicable diseases, hepatitis C infection is one that has increased prevalence locally. The epidemic of chronic diseases poses devastating health consequences for individuals, families, communities, and health systems. In fact, socio-economic costs associated with these diseases make preventive and control measures a challenge for all. In the latest 2019 statistic, neoplasms and diseases of the digestive system were among the top 10 causes of hospitalization and also death in the Ministry of Health healthcare facilities. Whatever the disease is, awareness and knowledge among both patients and healthcare providers are important for prevention, early detection, diagnosis, and treatment. In addressing the launching of the 4 CPGs, allow me to address key points on each medical condition. Ladies and gentlemen, according to the National Health Mobility Survey 2019, the national prevalence of depression is 2.3%, which translates to about 500,000 Malaysian adults having depression. Major depressive disorder is an illness that is projected to be the highest contributor for disease burden in 2030 at 6.2% of total disability adjusted life years. Untreated MDD can lead to suicide, whereby there is recent concern on the rising trend in the number of suicide and self-harm. In MDD, treatment to remission is the targeted outcome. Addressing the gaps in the treatment can ensure optimal functional outcome and preventive further relapses of this illness. With the advent of more novel treatment approaches in the recent years and emphasis on early treatment, the clinical outcomes can be enhanced. There is also a dire need to recognize depressive illness among special populations such as the perinatal group and also those chronic medical illnesses. In Malaysia, the prevalence studies have shown that the antenatal depression can range from 10.3% to 13.8%, while postnatal depression ranges from 3.9% to 21.08%. Depression can commonly coexist with chronic medical illness such as diabetes and coronary heart diseases, where unrecognized depressive symptoms can significantly affect the clinical outcome of the main medical illnesses. Rheumatoid arthritis, on the other hand, is an important cause of arthritis worldwide, with a reported prevalence of 0.3 to 1% of population. In Malaysia, the prevalence is estimated to be 0.5% or 5 cases per 1,000 population. Based on the Malaysian National Inflammatory Arthritis Registry, there is often a delay in RA diagnosis as only about 50% of cases are being diagnosed within a year of symptoms onset. Delay in the diagnosis and late initiation of appropriate treatment will lead to permanent joint disruption, deformities and disabilities among patients with rheumatoid arthritis. Early diagnosis alongside treating to target strategy enables better patient outcomes, improve quality of life and prevent joint damage. On the other note, breast cancer is the most important cancer among women in Malaysia. Overall, it contributed to 19% of all new cancer cases diagnosed in 2012 to 2016. The percentage of late diagnosis, stage 3 and stage 4, had also increased to 47.9% in the same period. The management of breast cancer has transformed by advancing clinical application of research-based basic biologic concept of cancer itself. This is emphasized on the local regional control through various types of surgery, leading to changes both in local regional therapy and adjuvant systemic therapies, including targeted biologic therapy. In surgery, radical mastectomy is replaced by modified radical mastectomy and eventually breast-conserving surgery with breast irradiation becoming the preferred method of local regional management in appropriate patients. Similarly, in early breast cancer, sentinel lymph node biopsy has become the accepted mode of surgery in clinical non-involved axillary lymph nodes. Finally, multidisciplinary team meeting has become the epicenter of the best management a breast cancer patient should receive. For hepatitis C, screening is important as most of the patients are asymptomatic. Failure to identify early prevents linkage to care and successful control of hepatitis C virus infection. Hence, targeted screening for high-risk population has been recommended. Relevant laboratory testing is done by either serological and molecular testing for screening as well as for confirmatory. Subsequently, assessment of severity of liver fibrosis by either non-invasive as well as invasive method is recommended to determine the prognosticate treatment regime. Effective treatment options are available and the cure rates are seen by sustained virological response rate for general as well as special population. Ladies and gentlemen, today we will witness for the first time the launching of 4 evidence-based Malaysian CPGs. 2 of them are updated versions, while the other 2 are new additions. It is meant to address the main issues related to aspect of care for the specific medical conditions, especially the variation in practices in our local setting. The CPGs will help to identify those at risk, screen them, and offer standardized treatment and preventive measures in an evidence-based approach. For your information, the task of completing these CPGs and their implementation strategies could not have been accomplished without the dedication, commitment of many people. Thus, I would like to congratulate and thank the development group, the review committee, the external reviewers, as well as the CPG Secretariat of the Ministry of Health for producing these comprehensive CPGs. The multidisciplinary teams comprise of experts from the related disciplines from Ministry of Health, Ministry of Higher Education, and the private sector. I would also like to thank the relevant professional societies and Academy of Medicine Malaysia for their continuous support in the development of these CPGs. Ministry of Health is always supportive of all efforts aimed at improving healthcare delivery. We will continue to ensure patients with medical conditions addressed in the CPGs are given the best healthcare and access to healthcare providers with relevant knowledge and skill to manage the disease. This will be done by training of core trainers nationwide using the CPG's training module, as well as making the necessary investigations and treatment available in the clinical practice. In line with the above, the state health directors, hospital directors, district health officers, dean of medical schools, specialists, medical officers, allied health professionals in the public and private sectors should use these national evidence-based documents as a tool to aid the management of the relevant medical condition. I would like to end by thanking all of you for being here today. Ladies and gentlemen, it is with great pleasure that I officially launched the Clinical Practice Guidelines for the Management of Major Depressive Disorder, 2nd edition, Rheumatoid Arthritis, Breast Cancer, 3rd edition, Chronic Hepatitis C in adults. With that, I thank you.